First, we are going to demonstrate the bed mobility. First, the rolling. As we can see, we bend the leg and then we put our both hands, one on the upper back scapula and other on the lower back on the hip, and then we turn. Here, the patient, we are going to put the patient on the sitting on the edge of the bed. We use the same technique and then put the legs out of the bed and then help him as needed to make him sitting up. Here we are going to demonstrate the slide sheet. So as same, we are rolling the patient, then we put the slide sheet, then to the other side, and here we are doing slide one layer of the sheet against the other layer. We are not carrying the patient, but we are sliding the patient, and then we have side to side, so we have to turn the slide sheet and then use it. Here we are going to demonstrate how to put the sling to transfer the patient using the hoist. So as we do for running, we are doing same, turn side to side, put the sling, then we are passing the sling under the both lower limbs. And here we have to remember to cross the straps or the sling, okay, and then bring the hoist. We put the brake on, then we put the straps, so now we are going up, carrying the patient using the hoist. We have to ensure the head is supported by the sling, and then we are releasing the brakes and taking the patient out of the bed. Once the patient is out of the bed, we are bringing the wheelchair, okay, and then we are opening the legs of the hoist, okay, to able to put the wheelchair. Once the patient is coming close to the wheelchair, okay, we are put on the brake of the hoist again, then we are going to put the patient down. We have to take care of the patient head. Now we are releasing the brake and then remove or disconnect the sling. First of all, we have to put on the belt for patient safety. Then we are removing the straps, okay, to relieve any pressure under the legs. Okay, so we have to ensure the wheelchair is straight upright when patient are transferring. Once the patient on the bed, then we can tilt the patient. Now we are going to transfer the patient back to the bed. So as we see, we make back the wheelchair straight upright. Okay, we put back the sling, and we are going to do the same process, remove the belt, and then we are going to put the sling on the hoist. Then we are raising the patient up. Here we have to put the hands crossed and ensure the hands not out of the sling. Now we are carrying the patient up. We remove the wheelchair. We release the brake of the hoist. Then we are going to put the patient down on the bed. So once the patient on the bed, we have to put the brake on, then put the brake off and remove the hoist. Now we are going to remove the sling. As we apply it, as we remove it. Now we are going to transfer the patient to the wheelchair using the slide board. So first we put the patient sitting on the edge of the bed, then we put the slide board and help the patient as needed, okay, and to the wheelchair, and then we remove the slide board. Then here we are going to transfer the patient back. Okay, we have to ensure the patient is putting his hand straight. Okay, and here is a demonstration for a patient who can do a transfer with minimum assist. Then we are going to use the slide sheet. For some cases we can use a slide sheet with a slide board to transfer the patient to wheelchair. So here we are turning the slide sheet while patient is sitting up, and then we are going to use a slide board, and then we are sliding the patient using the slide sheet. Here you need 2 persons to support the patient back. Mostly like this patient, they don't have a good trunk control. So here to remove the slide sheet while patient is sitting, now we are going to demonstrate the pivot transfer. Pivot transfer, we are using the transfer belt or gate belt to hold the patient. We help the patient to do sit to stand. Then patient can turn doing few steps, and then we help him to sit down. And here demonstration to go back to the wheelchair. Now we are going to demonstrate transfer bed to bed. Okay, using the slide sheet and using the transfer board. Thank you for your attention and watching the video, and all the time remember that your safety is important as patient safety. Thank you.